So first off, I'll just introduce myself. My name is Danielle O'Connor. I'm also a naturopathic doctor. We're going to be here today with Dr. Jenna, and thank you so much for being here. Okay, so first off, just want to mention, if anybody does have questions, please feel free to put those in the chat, and I'll have Dr. Jenna answer those questions at the end. We will also have a lot of information going in the chat in terms of how you can contact Dr. Jenna, as well as her socials if you want to follow her. But you know what, we will get started. So like I said, my name is Danielle. We have this wonderful session here on Health Buddha, and we're speaking with Dr. Jenna about maternal focused care. So really how naturopathic medicine can help you thrive postpartum. So you know what, I'm going to throw it over to Dr. Jenna so she can just introduce herself and tell us a little bit about herself and her practice, and then we'll get into some questions.
Oh, well, thank you so much, Dr. Danielle, for having me. I'm so excited. But yeah, hi, everybody. I'm Dr. Jenna Priestap. I'm a naturopathic doctor, and I have a virtual practice where I really like to focus on women's health, especially maternal care, because if you're a mom, if you're a soon-to-be mom, then basically maybe you've noticed that there's a lot of that lacking. I'm a mom of 3, so I've been through the whirlwind of postpartum, and honestly, naturopathic medicine can perfectly fill the gaps, basically, for helping you thrive during that time. And that's basically what I want this session to be about. I just want to give you all the good details and really help prepare you.
Wonderful. Well, this is great. I'm also a mom. I see we've got Elizabeth on camera here. Hello, Elizabeth, with your little one. This is amazing. Perfect. So you know what? Let's get started. The first question I have for you, Jenna, is what are some common misconceptions really about that postpartum period and postpartum care?
So 3 common misconceptions are basically, one is that your healing should be done at 6 weeks. In reality, this 6 weeks really more so corresponds with that physical healing, the bleeding of after you have your baby, you also birth the placenta, you leave a plate-sized wound in your uterus, hence why rest is so important. But basically that should be fully healed by 6 weeks. Any perineal healing that needs to be done should be done there. However, when you have a baby, you are completely cracked open spiritually, emotionally. There's so much more that goes on. And a lot of women get caught up in that they should be feeling like themselves by 6 weeks, and that they should be fully healed by 6 weeks. And in reality, even though conventional care ends at that point, your midwife or OB, in reality, there's so much more to come for that first year. And again, that's exactly where naturopathic medicine can be the perfect support, in that you can book in with your ND and talk to them about the new challenges that come at, like, say, 3 months, 6 months, all those different things. But a lot of women get caught up in, I'm 6 weeks postpartum, I should be fully ready to go. And that's a very common misconception. Another big one is that postpartum depression and anxiety are only going to show up in those first 6 weeks. In reality, you can get postpartum depression, anxiety through that whole first year. So again, with care ending at 6 weeks, there's a lot of women that are basically left in the dark. And at 6 months, they're like, okay, I'm not coping well. I don't feel like myself. I'm crying unexpectedly. I can't see the funny side of things anymore. And they just are left to believe, oh, okay, this is motherhood now. Maybe I'm not cut out for this. Maybe I'm a bad mom, and that's why I feel that way. When in reality, it's these mood disorders. And another thing with postpartum anxiety and depression is that it's not just in your head. So there are actually physiological reasons for these. Certain nutrient deficiencies, which we can talk about later, are actually correlated with an increased risk of postpartum depression or anxiety. And what I mean is basically the nutrients that you use to create your beautiful baby, when these are depleted, actually increase your chances of postpartum depression and anxiety if they're not replenished. So a lot of women first of all, think that they should be back to normal at 6 weeks. Then they don't realize that these mood disorders can come up anytime in that first year. And it's not just, again, in your head. It's not because I'm a bad mom, I can't cope. No, your body needs a little extra support. And again, that's exactly where a naturopath can come in. They can requisition the right, I got a little friend, the right lab work to identify anything going on, and also help you implement those supports that are going to help to correct those levels.
That's amazing. It's so true. It's definitely more than just that postpartum physical period that we have to think about. And I love that you mentioned, even with postpartum depression and anxiety and our mood, like it's ever changing, right? So how you felt in that first 6 weeks, like obviously our hormones are changing a lot in that period, but they're still changing over, the next year. And so it really does go up and down, and you do need continued support, because it's much more and much deeper than that first 6 weeks that we traditionally look at for postpartum period. So I loved how you clarified that. Wonderful. Okay, so you know what? Another great question that I think just, women in general, whether this is their, first child or first pregnancy or second or third or more, but how can a pregnant woman really best prepare herself for postpartum? Because, everybody's always thinking about the pregnancy and preparing for, pregnancy, or maybe even prior to that, fertility, right? Like that whole journey. And then again, yes, it's that 6 weeks after you have your baby, which is amazing, but ahead of time, how can a woman really prepare for that postpartum period?
Yeah, for sure. That's a great question. So the best time to prepare for postpartum, pregnancy for sure, even if you're trying to conceive, just planting the seed and thinking about it then. But what you can do, there's a couple things that I always recommend. So one actually is going to be boundaries. So discussing with your partner, what is it going to look like when you've had the baby? Are you gonna let people come over unannounced? Are you going to let only certain people come over? Because when your baby comes earthside, basically, your mind is going to be focused on that. And one of the huge stressors that I see so commonly that goes unexpected is that piece, the boundary piece. You're focusing on taking care of this new baby, but now you've got people dropping in unexpectedly. And now maybe you and your partner didn't talk about what you wanted, and your partner needs to be your voice in that time. But if he or she doesn't know that, then that can cause a lot of tension. So really focusing or discussing any boundaries there. The other big thing is going to be thinking about your nutrition ahead. So this is where I fully love freezer meals. So one big thing for your energy and mood is going to be controlling your blood sugar. So what you want to focus on are very nutrient dense foods. You want to be making sure you're making things with healthy fats. You want to have enough protein, and you really want to be avoiding refined sugar. I know people mean well when they come over with donuts and cake and stuff like that, but in reality, you're going to eat it, and then your blood sugar is going to drop, and you're going to feel even more tired and even more irritable than you did before you had it. So really focusing on preparing yourself for those meals. I actually have before I forget, I've created with Nook. It's a meal company actually here in KW, and there's mother specific meal delivering program that we provide. I can actually provide you with the links for that. But looking for either a meal service or freezer meals is going to be huge. So meals, boundaries. The other big thing is, and again, you're going to be needing to work with a practitioner for this, but getting your nutrient levels tested. So iron, for example, this is really important for blood production. You are making a baby's worth of blood. Your body is going to give everything that child needs to grow. So iron deficiency, though, when you don't have enough, iron deficiency anemia has correlated to a 66% increased risk of postpartum depression and anxiety. So that alone, during pregnancy, you really want to make sure you're getting these nutrient levels tested. That way, if you already see, oh, okay, I'm deficient right now. Well, if I want to decrease my risk during the postpartum period, what can I be doing now to bring those levels back up? You really want to make sure that you're replenishing those levels, and that way you can reduce your risk there. So honestly, the big things right now in pregnancy are going to be boundaries. What is that going to look like? Meals, your freezer meals, your nutrition, and then also getting nutrient levels tested and ensuring that you're basically optimized for that time. That way you just have to focus on baby, and you have everything else already handled for you. And again, that's where a naturopath can really come in, because while you're focusing on baby, he or she, whoever you choose, can focus on you.
That's amazing. I love that information, because I think it's also very practical, right? Like it's something, those are things that we can easily do, right? In the sense of like speaking with our partner, about what are those expectations, and, getting your iron levels tested, which really is something that is done, during pregnancy. But, one of the things that I say to my patients too is like, I like my patients to ask for those results so that they can also see like, where am I? Am I slightly under? Am I slightly over? Like, are my levels good? And I think too, that's where a naturopath can really support you in the sense of looking at kind of those like optimal levels, and not just like, oh, are you flagged low out of the range, right? So yeah, I think that's great. And then freezer meals, and to have like a service, it's a no-brainer, because you have so much going on, and, to think about when you have a new baby. And so to just be able to easily grab something that is healthy and nutritious and really supporting your body in healing during that postpartum period, I think those are wonderful suggestions. So I love that. Okay, more questions. And again, if anybody has questions, please feel free to drop them in the chat. Okay, so you were talking about like iron levels. Obviously, that's going to be really important. But what sort of investigations or testing should a woman have during the postpartum period?
Yeah, I love this question, because usually what happens is once baby comes earthside, everyone's focus is on the baby, when in reality, your hormones and everything are going crazy. So what I recommend and what I do with my patients basically is within the first, ideally at like 3 months, sometimes this can't happen, that's okay. Ideally within the first 6 months, the things you want to check for, there's something called a complete blood count, basically looking at your red blood cells, how many are there, how much hemoglobin is it, that's important for iron. But this is checking especially for anemia. So again, anemia increases your risk of those mood disorders that can show up anytime during that first year. So we want to check their levels within the first 3 months. That way we can mitigate any risk basically. But also is going to be, so your iron levels, your B12 levels, because this also contributes to anemia. So it's CBC, iron, B12, your vitamin D. Vitamin D is very important for energy, very important for mood. So even if your little one is providing you with a full night's sleep, you might still be tired because your vitamin D is low, for example. And this isn't just like motherhood anymore. What I always say is that on a scale of 0 to 10, 0 is no energy at all, 10 is the most. You should be minimum at a 6. Anything 6 and below, investigation should be done. And a lot of people are surprised by this. Like, even if you have 4 kids, you should be functioning at this level, because there's probably something else going on. It's not just, oh, this is motherhood now, I'm forever tired. No, it's let's check and see what's going on. But I digress. And the other thing too that I recommend is a thyroid panel. So not just your TSH. TSH is commonly checked. This is good, but this is the message from your brain basically to your thyroid and how hard it needs to push to get your thyroid to work. What we want to look at, especially because your thyroid can really be affected in that postpartum period. It's actually something called postpartum thyroiditis can come up. But in a thyroid panel, we're looking at free T3, free T4. These are hormones coming from the thyroid, reverse T3, TSH, and then also we're going to be checking for antibodies. So it's anti-TPO and anti-thyroglobulin, basically to ensure that the thyroid itself is functioning and isn't too impacted with all of the changes postpartum.
Wonderful. Yeah, I know I've had many patients that it was, pregnancy or the birth of their child that really set off the thyroid, right? So I think it's, super important, especially for those thyroid antibodies, because those aren't ones that our medical doctors are normally testing for, right? So you almost need to be already with an endocrinologist to get those antibodies tested. So that advantage of being with a naturopath who can requisition those tests, I think is fantastic. And now one question, really in conjunction with the testing that you were talking about, I noticed that you didn't mention kind of the typical women's hormones like estrogen, progesterone, testosterone. And is that more because postpartum, like everything's all over the place? Like what's your thoughts on that?
So with respect to that, a lot of the times, especially if someone's breastfeeding, so when you breastfeed, the prolactin, the hormone that's encouraging the milk production, that's shutting off the hormone that's going to start causing the release of FSH, LH. Your estrogen and progesterone are already really going to be muted, as well as your FSH, LH, sorry. And basically, so a lot of the times, like you don't have your period back. So I don't typically look at those yet. I wait a little longer, like especially after the 6-month period, we can look into those. But for the first 6 months, what I really want to focus on are those nutrient levels, because you've lost so many nutrients making your baby during pregnancy. You're continuing to bleed and heal postpartum. You're losing more nutrients. If you're breastfeeding, that's continued. Like a lot of women don't understand that your body's going to give everything your baby needs to grow from your stores. So you're the one actually that's not going to benefit from replenishing those nutrient stores. And it's those nutrient deficiencies that are going to cause the things like exhaustion, irritability, increased risk for mood disorders, all those things. So those are the ones I more so look at first. And then later on, we can look at the usual female hormones.
Wonderful. Yeah, that's great information. Because I think a lot of women ask that, right? Like in the sense of like, oh, are you going to test these hormones? But it's especially in that first time, they don't necessarily need that, right? So it's something I will ask you though, in terms of your practice, do you typically start seeing women, prior to conception, through the pregnancy, through postpartum? Is it a full process, or do you just do postpartum work? Or just tell us about kind of your process for how you work with women.
Yeah, so I love working with women. It's kind of funny because my two passions are postpartum as well as like period health. So they kind of go hand in hand. What has happened countless times. So I'll work with a pregnant woman and we'll prep her for postpartum. We'll be working together, and then she gets her period back and we work on really optimizing that. Because again, if it comes back painful, well, your period shouldn't be painful. So we implement some supports there. And then usually they want to try and conceive again. So then I'm working with them through that as well. So a lot of the times it's fun when it goes full circle. But no, I work with women through pregnancy, postpartum, as well as trying to conceive as well.
Perfect. That's wonderful. Okay. Yeah. I wasn't sure, like where you were at with that, but I think that's great. And I think the like period care after is so important, obviously, because we want to make sure that these women and our patients are back on a regular and normal cycle and feeling good, right? So and that's obviously all part of postpartum care. So wonderful. I'm just going to take a peek in the chat to see if we have any questions from anybody. There is some information here in terms of links, like I said, that you can follow Dr. Jenna on her Instagram. as well as, please join us on Health Buddha. We've got a lot of different conversations and webinars about different topics. You will be able to access this recording. So yeah, definitely please, join us there. I don't see any more questions here. You know what, I will just kind of ask you in terms of your take as a naturopath and postpartum care. And I know you were talking a lot about, like nutrients. It's really about like getting those nutrients in and nourishing our bodies after childbirth. Are there any, types of diets that, specific diets you suggest, or is it more just really about getting real food? What's your take on that?
Honestly, yeah, I like to keep it simple. I don't want to stress you out more about what you should be eating or what diet you should be following, but definitely focusing more on whole foods. Trying to avoid as much as possible, like we said, the refined sugar, any inflammatory foods really, because again, if you are someone who's sensitive to dairy, for example, if it's constipating you and you just had a baby, well, your perineum kind of needs a little extra care. The last thing you want to be doing is constipating yourself right after childbirth. So we want to be also thinking of that ahead as well. So more so just trying to focus on those really healthy, and well-cooked foods. So warming foods is something that we really want to focus on instead of like a raw salad, for example, more so like stews. If anybody wants to help you, give them a list of foods that they can make for you. Maybe even like stir fry, again, stews, soups. These things are really, the nutrients are very easily absorbed. And that way they really help to nourish your body properly.
Amazing. Wonderful. Okay. So that is great information. Okay. So you know what? I'm not seeing any questions. I do want to thank you so much, Dr. Jenna, for being here and for joining us on Health Buddha. It was wonderful to have you. Dr. Jenna will be joining us in a couple more weeks talking about period care. So please don't miss that. We will have some information going out for registering for that webinar soon. And so again, thank you so much for being here with us and just really having this discussion and opening up these topics and really helping women understand that there's more to postpartum care than just that, 6 weeks right after having their babies. So wonderful.
Well,
thank you
so much.
Thank you
for having me.
A bunch of thank yous. Oh, you're welcome. And yeah, everybody have a wonderful day. And don't forget to come back and sign up for Dr. Jenna's next webinar. We'll see you guys soon. Okay, take care.
Thank you guys.
Okay, bye everyone.